Here is a routine of exercises to complete for cervical spondylosis. Welcome back to Age Fit with Tess. My name is Tess, physiotherapist. By the end of this video, you're going to know how to complete 7 exercises for cervical spondylosis. This video contains progressions following on from the video cervical spondylosis exercises, linked in the cards. Join the Age Fit with Tess Facebook group to get further support with building fitness and strength. To work with me one-on-one via consult or the Fit with Arthritis program, head to www.agefitwithtess.com. Let's get started. Prior to commencing, it is important to note you should not feel symptoms of dizziness, nausea or double vision when completing cervical or neck range of motion exercises. If you do experience these symptoms, seek advice from your physiotherapist or doctor before continuing. Starting with flexion. Bend at your neck to touch your chin to your chest. Use your hands on the back of your head to create gentle overpressure, to the point where you can feel a gentle stretch. Complete 3 sets of 10 to 30 second holds. The aim of this exercise is to improve range of motion within the cervical spine, with overpressure holds a progression of range of motion exercises seen in the video, cervical spondylosis exercises. You should not feel increased pain or symptoms. One more time. Bending at the neck to touch your chin to your chest. If you do experience increased pain or symptoms, complete without overpressure to the maximum range possible before the onset of pain and symptoms. Moving on to lateral flexion. Bend your neck to bring your right ear toward your right shoulder. Use your right hand to provide the overpressure. Again, hold for 10 to 30 seconds. Repeat, bringing your left ear toward your left shoulder, using your left hand to provide overpressure. Again, aiming to feel a gentle stretch. With spondylosis, you may feel stiffness in one direction of movement more than the other direction. If this is the case for you, complete additional sets as needed. In our final set, holding on the right and coming to the left, again bringing your ear toward your shoulder. The third variation is rotation. This time, turn your head to look over your right shoulder. Use your left hand to push gently on your face to provide the overpressure, holding for 10 to 30 seconds. Repeat, now turning your head to look over your left shoulder, providing the overpressure with your right hand. As we move through multiple directions of movement in this routine, there may be some directions that increase pain. This will likely be different for each person, as spondylosis can impact various aspects of the discs and joints of the vertebra within the cervical spine. If there is a direction of movement that you feel increased pain, work within the maximum range you can before the pain begins to increase. In our final set of rotation, holding toward the left to finish. The fourth exercise is levator scapular stretch. Look down toward your right hip pocket and provide gentle overpressure with your right hand. Hold for 10 to 30 seconds. Repeat, looking toward your left hip pocket, using your left hand to provide the overpressure. The levator scapulae muscles attach from the first to the fourth vertebra to the scapula or shoulder blade on either side of the neck. The stretch aims to release tension that can develop, particularly when range of motion is limited due to experiencing pain from spondylosis. Repeating again for the final set, looking down toward your right hip pocket, using your right hand on the top of your head to provide overpressure. And now toward your left hip pocket, using your left hand to provide the overpressure. The fifth exercise is an overhead stretch. Bringing your right elbow up over your head, using your left hand to hold in position. This overhead stretch helps to move and relax the muscles of our neck and upper back. Repeat, this time bringing your left elbow up over your head, holding with your right hand. In addition to relaxing the muscles of the neck and upper back, this movement aids in counteracting the common rounded shoulder posture, which can increase tension through the muscles of the neck, contributing to neck and back pain. In our final set, holding your right elbow over your head. And now bringing your left elbow over your head, holding with your right hand. The sixth exercise is thoracic rotation. Turning out your shoulders toward the left, holding for 10 to 30 seconds. As a form of overpressure, hold the arm or the back of the chair with your right hand. Repeat, turning toward the right, this time holding onto the arm or back of the chair with your left hand. This exercise aims to increase range of motion within the upper to mid back, from the thoracic spine to the lower cervical spine. It can also assist in releasing muscle tension in rotator muscles that traverse the cervical and thoracic spine, including semispinalis, multifidus, and splenius cervicus, which may hold more tension than usual for those in pain with cervical spondylosis. Repeating again, turning at your shoulders toward the left, holding for 10 to 30 seconds, holding onto the arm or back of the chair with your right hand for additional overpressure. And turning toward the right, holding the arm or back of the chair with your left hand. The seventh exercise is scapular retraction. Sitting, with your arms by your side and your elbows bent, bring your shoulders back to squeeze your shoulder blades together. Hold for 10 to 30 seconds. From the side angle now, seeing that we bring the elbows back and slightly inward toward the middle of the back, maintaining an upright posture throughout. Relax the shoulders between reps. Scapular retraction, alongside our upper back stretch and thoracic rotation exercise, assist in rectifying the rounded shoulder posture that can develop with cervical spondylosis. The eighth exercise is shoulder shrugs. Lift your shoulders up toward your ears. Repeat 10 times. Shoulder shrugs can help to ease tension in the muscles of the neck and shoulders, including the trapezius, sternocleidomastoid, scalenes, and levator scapulae muscles. These muscles again can hold tension as a reaction to pain resulting from spondylosis. Again, lifting your shoulders toward your ears and relaxing between reps. The ninth exercise is butterflies. With your arms by your side, reach up toward the sky and come back down. Repeat 5 to 10 times. Remember to join the Age Fit with Tess Facebook group to get further support with building fitness and strength. If you have arthritis, joint pain or chronic injury and unsure if you have the right exercise program put together, make sure to get your complimentary Are You On Track self-assessment to identify if you are meeting 10 key components of a successful exercise program. Head to www.agefitwithtest.com to get your copy. Make sure to subscribe and ring the bell for the next video where I'm going to go through top tips for running with osteoarthritis. See you next time.